When a person moves to end stage of Alzheimer, one of the complications is that the person will have issue swallowing. Now, there are different thoughts about whether one should actually put a nose tube, to pass a nose tube or nasal tube on the patient who has Alzheimer. Because one thing is that when you pass a nose tube to a person, it is very uncomfortable. With a normal person, we can reason with the person. The importance of the nose tube is to enable the person to be able to eat, especially for those who lose the swallowing reflex or have any problem with swallowing, getting the food from the throat down the stomach due to maybe certain illnesses or treatment like chemotherapy or radiotherapy. So the person would be able to put up with the discomfort. But in the case of an Alzheimer patient, and this is normally seen in the end stage, we can't reason with them. So if we put a person on nose feeding, then in nursing home, they'll probably sedate the patient. But if we are caring for them in our home, we'll probably need to restrain. Now, my mom was actually admitted to ICU and hospital. She was hospitalized twice last month, as she suddenly lose much of the swallowing effect. Means that she has not been able to eat, and she refused liquid because she can't consume liquid without choking. So when she was admitted it caused her blood pressure to drop so low that the machine could not even read it. And then even the hospital machines, the manual and also the manual with the pump, and as well as their automatic readers, could not detect my mother's pulse at her BP at her hand. But they could get some reading from her calf occasionally on her legs. It was so bad that she was hospitalized. She was given IV drips to actually restore her electrolyte balance. I know that in many parts of the world, now the treatment, the understanding is a kind of like let the patient go off naturally. But, you may hear some noise in the background because I'm actually with my mom and she is actually sleeping after her food. So do forgive for the snoring sound that you hear, but I'm looking after her most of the time. Hence, there will be some background noises that she will make, some occasionally singing and all this. But she was really not like that last month. Last month she looked half dead and she was like a zombie. If I had followed like what is in the other videos, then we would just let nature take its course. But here in the hospitals in Thailand, that's not what the doctors do. From two different hospitals, all the specialists and the doctor who treated my mom said to put a feeding tube because the nutrient that she's taking is no longer enough. So after putting in the first time after ICU, when I took her back, we decided to actually try to give her fluids and all this, and food, her favorite food and stuff like that. But then within about 10 days again, she was going into like a kind of like a semi-comatose stage because we had an oximeter and we actually measured the oxygen. It was very low. It was about 78, 80. So it was very low, her oxygen level. So she was hospitalized. She was took her to a nearby hospital. They couldn't get her BP, sent her to emergency. And then, in fact, they even resuscitated her because her heart rate was so faint. Then she was warded for actually 7 nights and 8 days in the hospital. So after in the warding itself, the doctor actually put in the nose tube. Now, if my mom were to struggle with the nose tube, as logically I would have expected she to struggle, then we will have to take, if she were to struggle because of the discomfort as well as being restrained, then logically we would not be able to put in the tube. But after putting in the tube, she did not struggle. We actually restrained her hand, and because her Alzheimer has already progressed, that she didn't know that she was being restrained. Some people might argue that this is maybe inhumane, but to me, honestly, I feel it's more inhumane if we let the person starve to death. Dehydration, because if the person is not able to consume fluid, the body is going to be very heaty, the organs is going to be very heaty internally, and the patient feels a lot of discomfort. And this lasts for months, because you'll still be able to get a bit of fluid in, but it will last for months before the person passes. And when the person passes, they are just like a stack of bones. They are so thin and malnourished. Anyhow, I'm thankful that my mother didn't struggle. We actually bought the special mittens. The pharmacy sells it. We have to go to a specialized pharmacy, because in Thailand here, they have bed restraints. It's not an ethical issue. If the patient doesn't cooperate, they restrain. They will tie up. They have all the restraints ready. That is, the priority is to save the patient. It's always to save the patient. Here, the culture here is to save first, and then ask for money later. Anyway, we bought the mittens. You have to cover all her fingers, and then we have to tie it to the bed post. Not too tight that it make her uncomfortable, but not too loose that it actually allowed the mittens to reach her nose, and then she will start scratching it. She managed to pull out the tube once while she was being in the hospital, and the tube was being reinserted. When the tube was reinserted, because they actually had 6 nurses to hold her down while one of the nurses insert. And I believe that at the second reinsertion, it was done roughly, because they had to force her and her muscle were tense. So I believe it caused a lot of inflammation on her throat. Because the first time after the incision was done, she didn't have much complication. But after the second insertion, about 2 or 3 days later, she started developing very bad wheezing sound. Very bad, sad wheezing sound, as though like she's dying the whole day. It's like a person snoring super loudly, but it's whole day, even when she's awake. And she was so exhausted by all the wheezing. So when we got her to hospital for the 3rd time, to the emergency room to see about the wheezing, they actually suck out a lot of phlegm. So that was when we brought the phlegm suction machine. And then we also, the doctor also administered anti-inflammatories, which we took about 5 days, 2 tablets each, twice a day. And with that, the swelling on her throat subsided. And with the anti-inflammatory, her body was also, previously when we give her tube feeding, she was not really, like we check after, you have to check each time before we feed the person. We have to test with the glass syringe whether the previous food is digested or not. And every time, even sometimes 6 hours, 7 hours, the previous food was not digested. But after prescribing anti-inflammatory, the food was normally digested already. In future videos, I would like to talk about more about this nose feeding. But one thing that you need to, when we put a person on nose feeding, then it is ideally to get a hospital bed for that person. Because why? After nose feeding, the person has to sit up. The best is in an upright position, but if the person is very weak, then it is an incline. To use pillows and all this to incline is dangerous, because the patient may remove it or move it away. But if we use a bed to incline the person, then the person can stay in that position. Ideally, it's for 2 hours. But the nurse told me minimum 30 minutes. And also, because my mother tend to have the tendency for phlegm, we no longer make her lie down flat anymore. Like how a person normally sleep. There's always a slight incline on her bed. So this is one of the things with nose feeding. And for an Alzheimer patient, we have to restrain the hands. If the person doesn't suffer and the person is not aware of the restraint, then it is okay. For the case of my mom, I believe it's also because the environment, we all love her and we treat her very well. She feels kind of safe, not like she was not being abused or being rough handled. So the restraints don't really bother her. Sometimes she will look at why my hand looks different, that kind of thing. But to see her be able to regain her energy after about consistent 2 weeks, 3 weeks, I think this is already the 3rd week, she has now regained her energy. The light came back in her eyes. She's starting to sing, hum some her lullaby. Actually, she always hummed the song from the, I think it was originally sang by Dean Martin called Sway. So she seems to like the song and she's cheerful. So this is something that makes me very happy than to see her wasting away. It's just something that I can't bear with. And also the culture here is something they can't bear with too. The doctors all can't bear with it. People have no issue seeing her on restraint, on the hand being tied up with the special mittens. It's not any ordinary mitten. This one is the special bought from pharmacy for the restraint one. So it covers the hand and it has ventilation. So it also a hook for the air to actually. It's actually hooked to actually another string where you can tie to the bed. So I will give a visual of it in this video. So this is the point of view that I wish to give on tube feeding for Alzheimer patient, because from the videos I've watched out there, health professionals many people are actually saying against it. It's just that one thing, when we put a person on tube feeding, the life change for the caregiver. I don't think if we can put a person in nursing home, I don't think it is possible to get that level of care. You will have to, a lot of things about your life is going to change. Like for me, now I'm looking after her almost 24/7. I have to learn to sleep when she sleeps. And at night, I'm only getting about 2-3 hours, and if I'm lucky, 4 hours of sleep on a daily basis. And I have to compensate for that sleep towards the day when she's asleep. So this is a compensation I have to make. And with the mittens, of course, she can no longer grab railings when we are trying to move and adjust her. So that means that she will be on bed bath. We have to bathe her and wipe her on the bed. She is on diapers. She's already on diapers before this already, because she was so weak from the malnutrition that she can't really go to toilet on time. So we will have to move her because her hand can no longer adjust. She's no longer able to grab or anything, because the moment we are afraid if we release the mitten, she's going to pull out her tube, and then you'll end up in emergency ward. So these are the things. When that happens, it means that more looking after. And my mom her weight dropped to about 50 kilo. But now I think with the food and nutrition, her weight has gone up to close to 60 kilo already. 60 or maybe 57. So she has regained weight and energy, and it is not easy to lift her, because my mom is taller than me. So when we make the decision to nose feed, we change the hospital bed, we bought an oxygen meter to give her supplement oxygen, because nose feeding, it will kind of obstruct the airway, then she don't get enough oxygen. So we have supplemental oxygen, and also we always need to take care of the mucus secretion. When we do that, we also will need about 2 person, a minimum of 2 person, because they always slide down the bed and you always have to carry them up. A lot of carrying the person and moving the person, it is safer to be performed with 2 person, not 1. So there's a lot. This is you can have like 1 person really focus on looking after the person, but there has to be another person standby to help with the lifting, because when we give the person food to eat, the person definitely have to be on preferably on a sitting position, and if not, minimum is on an upright incline of, the nurse told me it should be 45 degrees, but if cannot, minimum 30 degrees, to prevent the food from going, refluxing upwards and possibly going into the lungs. So this is actually preventable. If we keep that person for about 2 hours, or minimum half an hour to 1 hour, then the food will be digested, it will leave the stomach, and then it won't have the tendency to flow up. Also, when we put on nose feeding, the hospital will normally give a lot of guidance on what are the things that we need to do. Like for my mom, she's eating 4 times a day, and then there's a fixed amount of meal how much of ml of food fluid that can go in. We have a food bag order from the hospital. It's 350 ml of food, of blended food with pumpkin, eggs, chicken meat and liver, and a bit of fat, and bananas, some kind of combination which is dietitian approved. So that is about 350 ml per bag. And after that, we actually will have to add another 50 ml of water after the food is passed through the nose tube, to actually sort of like rinse the nose tube. So that give her about 400 ml, and it's 3 times a day. So she's getting minimum 1,200 ml of water a day. On top of that, they will actually advise whether how many times if you give water at the side, or if you want to supplement with ensure meal or something like that, we can still do that. But there will be nutrition or a senior nurse that will be able to give you the advice on what to do, what are the things to take care of. So this is the experience I wish to share on this tube feeding for people with Alzheimer. As I go along and I learn new things, I will make more of these simple videos to actually just to share. But as I mentioned in my earlier video, there will not be much editing done. I will just probably do a recording, and then I will just upload it to YouTube. So do forgive me for my now that my priority is to look after my mom. At the same time, I also realize that many people are feeling very helpless, and they don't know what to do. I mean, honestly, if we put an Alzheimer patient on nose tube feeding, definitely the level of care we will need much more. The person will be bed bound. We need to change the diapers. We need to wash for bed sores and things like that. But my mom looks so much more comfortable compared to the time when she was like wasting, so-called wasting away, and her body was so hot because it was dehydration. So this we need to have the resource to take care too, and also money financially to actually purchase lots of things like the hospital bed, the oxygen concentrator, the phlegm remover, the special food blend for her, the tubes that is required, and then the monthly treatments to go into to actually go to the hospital to actually for follow-up checkup, and to actually put in and remove the tubes. But from the previous time that we have done a nose tube change, the nurse was able to do it very professionally and in under 5 minutes, and she didn't really struggle. So it is a matter of the choice, and my goal in this video is to enable you to know that there is a choice, but there's also a price to pay, because we will definitely, if we go into the path of this nose tube feeding, we will definitely need to spend a lot of time with the patient, with the person that we are caring for. We can't really leave their bedside for long periods of time, like go to work or go to do something. It's like a full-time carer. So are we able to do it? Do we have if it's the responsibility, do we have other responsibilities that prevent us from doing it? Do we have financial constraints? Because if we start nose feeding, we can't take care, then it's also going to be a problem. So, but at least I really wish that you know that there is a choice. There is a choice, and it's not 100% that it is to let the person just waste away or literally starve to death. Just that whether we have the available resources and also the willpower and the determination to see through that. For me, to be able to see that my mom becomes cheerful and to regain energy and to look happy, to me that's all that matters, because I'm already her full-time caregiver for more than 4 years already. Okay, that is it for now. I hope this video is helpful to you in some way for your consideration. Take care.